Our friends with Western Governors University are back, and this time they're talking about online nursing programs and healthcare degrees. And yes, you can get them online.
That's right. We're joined by Vice President and Dean of the College of Nursing at WGU's Leavitt School of Health, Anne and Becky, the founder and CEO of Synergy 3C. Welcome in, ladies.
Thanks for having us.
Thanks for having us.
Wonderful to have you. I mean, when you think of getting a nursing degree, you just don't think of online courses, but WGU has your back.
Yeah, we have our pre-licensure nursing program offered in 24 states across the nation, and the vast majority of the coursework is done online. We cater to students who work, who take care of kiddos, who take care of their parents, and so they have a very busy life, and we want to be able to help still serve those students. So they do a lot of their coursework online, and then they come to one of our regional labs, beautiful facilities, where they get to navigate and learn different skills in those simulation labs, and then they go out to the communities and do their clinical placements there. And one of the things that we pride ourselves is training in place. They are already dedicated to those communities and stay in those communities after they graduate.
Very cool. That's amazing. Love the flexibility, so important. Becky, you work in Tennessee. You've worked here for a while. You have been really part of the healthcare landscape. What are your thoughts on healthcare here in Tennessee, and how can education positively impact the overall healthcare system?
That is a great question and a good pairing, actually. Healthcare and education, they go together well. I was a high school English teacher before I became a nurse, and then I realized that the teaching that I'm doing meant people's lives got better or they got worse. So I've been a practicing nurse in the state of Tennessee for 34 years and have seen people across all walks of life, and I very much concentrate on people's ability and willingness to be adherent with a plan of care if they can even get one. Oh, that's a big if. Forbes published an article last year that showed that Tennessee is among the worst in the United States for healthcare outcomes. We have problems that are unique to Tennessee, but are not in some respects, and in other respects they're not. We have a high incidence of chronic disease. We're known as the cardiovascular belt in healthcare. You know, we have hypertension, we have cardiovascular disease, we have problems with all kinds of vascular diseases. That breeds a pathway to another disease. Diabetes, huge in this state. Morbid obesity, people not getting up and moving. What are we doing to come together to solve our issues? And I'm really tired of hearing people talk about the problems that we have, but not looking at strategy. So strategy includes getting healthcare providers, and that includes doctors, nurses, and the allied health sciences to, one, want to go to school to train in those professions, and then retain them here in Tennessee, retain the top talent here. So healthcare and education go together like peas and carrots. If we're going to solve our poor outcomes, and by the way, we are among the very worst in maternal fetal outcomes in this state, with medical centers in every part of the state, but people don't always live in medical centers. You know, they live out in the rural areas where access is really difficult. So bringing clinicians in, educating them, helping them understand the fabric of the patient's lives that they are treating is really a good step forward.
Awesome. Amy, tell me a little bit about competency-based education, what exactly that is.
So at WGU, we're an online nonprofit institution that we're the pioneers of competency-based education. So instead of your standard seat time where you worry about semesters or midterms and final calendars, a student is able to schedule their exams when it's convenient for them, and they're able to pace through a course as they demonstrate understanding and competency of the content that's in those courses. And that's powerful for the adult learner who might have had a lot of different experiences in the non-classroom setting, but they have a lot of the skills and competencies that they can demonstrate within these courses. And that means that they can save money for their college education and be able to finish at a faster rate.
Awesome.
Amazing.
Count us
You know,
in.
when you have a doctor or a nurse, healthcare worker who just sticks in your heart and mind and soul, it's so much more than just your physical health. And I know that's what you guys are teaching at WGU. We've got about 45 seconds left. Please explain.
We are body, mind, and spirit, and you cannot treat one part of that without treating the whole entire person. People are a combination of genetics and environment and factors that are above their control. We have to take that into consideration. We have to treat the whole person. We have to understand in maternal fetal medicine, for example, that postpartum depression is a real thing. It's not a made-up thing. We need to be more aggressive in being attuned to it, being sensitive to it, and treating it. But that also happens if I've got high blood pressure. That also happens if I've got diabetes.
So true.
And at the Levitt School of Health, we know that there will have a shortage of over 8,000 nurses in Tennessee by 2035. And so part of that work is making sure that we train quality, competent healthcare practitioners so that they can serve the communities across the nation.
Perfect. Thank you guys for what you're doing. Thanks for coming in and sharing with
Thank you.
us.
Thank you for having us.
Learn more about WGU's health and nursing programs. Visit wgu.edu/health.